Let us go to interviewing. The topic is pain. When inquiring about pain, it is important to locate where exactly the pain is experienced. This is to get an idea of which channels or which organs may be involved. For example, it is important when diagnosing joint pain to identify which channel is imbalanced. It is also important to investigate other aspects of the painful sensation, such as the quality of the pain, what improves or triggers the pain, how and when it arose, if the joint feels hot, whether there is swelling, and so on. This is because the individual characteristics will help to differentiate one type of pain from another. In general, all pain is due to a stagnation of qi. Bu tong, zi tong, tong zi bu tong means when there is a stagnation, there is pain. Where there is free movement, there is no pain. A stagnation of qi can arise when there is an excess condition and in deficiency conditions. Sorry. In a deficient condition, there will not be enough qi or blood to circulate qi, blood, or jinye. The pain seen in a deficient condition will be milder. It will typically be described as being a dull or nagging pain or a tingling sensation. The pain will be relieved or ameliorated by palpating or putting your hand on the area. This is because the physical pressure will increase the amount of qi in an area that is qi deficient. Deficiency types of pain should, in theory, feel worse after physical activity and improve with rest. Whilst the statement is true, it is also misleading. In some situations, physical activity may well relieve the pain in a deficiency condition. This is because the physical activity will create a circulation of qi, temporarily relieving the stagnation and thereby the pain. Deficiency types of pain can be worse in the morning or if the person has been sitting still for a long time, which is otherwise a characteristic of excess pain. Again, this is because there's too little qi to move the stagnant qi and blood, which stagnate when there is no physical activity. Deficiency types of pain are often worse after exertion or return later in the day when the person is tired. This is seen, for example, in lumbar pain, where the pain is worse if the person has been standing all day. Deficiency pain will usually have arisen gradually. Acute pain, on the other hand, is almost always a manifestation of an excess condition. Excess conditions will often be aggravated by inactivity, especially lying or sitting still for long periods of time, such as when sleeping. Contrary to what is written in standard TCM textbooks, activity does not necessarily relieve the pain. On the contrary, if there is a severe stagnation of qi, blood, and jinye, such as when there is a sprain after a physical trauma or an operation, the movement of the joint will be severely limited, and there will be extreme pain if the joint or muscle is moved beyond this range. Excess pain will typically be aggravated or feel greater if the area is palpated. This is because the increase in physical pressure will increase the amount of qi in an area that already has an excess, something that can therefore seem counterintuitive. It is when people with acute pain, such as a headache, press their fingers against certain spots, for example, the temple, to relieve the tension. If you observe what they are doing, you will often see that they are massaging the spot with very small movements of their fingers. They are therefore not increasing the amount of qi in the area, but spreading it with a draining finger technique and thereby relieving the pain. Because excess pain conditions are aggravated by pressure, the person will often have a dislike of wearing tight clothes in the relevant area. This is seen, for example, in some women with menstrual pain having an aversion to wearing tight jeans up to and during the start of the menstrual bleeding. The descriptions of some of the individual types of pain can sound very similar. This is because the mechanisms involved in the generation of the pain can be fairly similar. Blood stagnation, for example, will manifest with a pain that is stabbing, piercing, and sharp. The pain will be localized to a specific spot and will not move around. Cold can cause pain that is fairly similar to blood stagnation pain. Instead of being piercing and sharp, cold stagnation pain is biting and cramping. The reason that the descriptions of these types of pain are so similar is that cold contracts and thereby blocks the vessels, stagnating blood. When there is cold stagnation, the area will feel either subjectively or objectively cold. Cold pain will be alleviated by heat. One should, however, be careful not to conclude that all pain that is alleviated by heat is cold pain. It is not. Heat is yang and thereby creates movement and activity. This means that most types of stagnation and therefore pain will be relieved by warmth. Pain from blood stagnation is often worse at night. This is because there is less movement of qi in the body whilst the person is sleeping, so blood is not circulated as effectively as during the day when the person is physically active. Furthermore, at night, blood flows back to the liver where it is stored. This means that there is less blood circulating in the channels and vessels, so there will be a greater tendency for blood to stagnate in places where there is already a stagnation. Pain from qi stagnation will often move from place to place within a specific area. The person may not be able to localize the focus of the pain to a specific spot, but will feel the pain in the area. Whereas a patient with cold and blood stagnation will often point to a specific spot with their finger. A patient with qi stagnation pain is more likely to show you an area with their whole hand, possibly moving the hand at the same time. There will often be distension or even bloating in the area. The pain itself usually in waves or is variable in its intensity. It can also be described as tension or pressure. Pain caused by wind will also move from place to place, but in this instance, the pain moves not only within a limited area of the body, but also from one area to another. Heat will manifest with a pain that is burning or stinging. Pain caused by heat can be relieved by putting something cold, such as ice, on the area. It can sometimes be relieved by the use of something hot like moxa, because the heat will help stagnate qi, blood, and jinya to circulate. Dampness will result in a pain that is heavy and dull. Thank you so much for your attention.